Hi, my name is Shavonne, and I will be discussing the article, How Do You Do Talk Therapy with Someone Who Can't Talk? Perspectives from Mental Health Providers on Delivering Services to Individuals with Aphasia, written by Katie A. Strong and Jenna Randolph, and published in the American Journal of Speech Language Pathology in November of 2021. This article highlights key concepts we have covered so far in class, including compassion, emotional intelligence, models of behavior change, and cultural competence. I will begin by summarizing the article. The authors conducted a qualitative research study using semi-structured interviews to gain information about the views and experiences of mental health providers regarding services provided to patients with aphasia. They started with definition and background information. Aphasia is a chronic condition that impacts one's ability to communicate, either expressively or in their comprehension. It is estimated that at least 1/3 of stroke survivors experience clinical depression. People with aphasia are 50% more likely than other stroke survivors to experience depression. Anxiety is seen in 44% of those with post-stroke aphasia. Depression and anxiety post-stroke are associated with poorer recovery and quality of life. Aphasia is a condition that is not well understood by the public or healthcare professionals, including mental health professionals. The research method. 6 mental health professionals met the inclusion criteria, including being a mental health professional for at least 1 year, English speaking, involved in treatment of those with a history of neurological injuries, and having provided services to at least one person with aphasia within the last 5 years. The selection included 5 women and 1 man with a mean age of 45 from various work settings in geological locations throughout the United States. Each interview was transcribed, reviewed, and examined for common themes. 3 themes and various sub-themes emerged as a result of these interviews. Theme 1 were barriers. These were factors limiting access to mental health services. One barrier was a lack of training of mental health professionals. When asked about the training they received regarding aphasia, only one participant expressed any formal training. That one participant with formal training was aware that her experience was rare. The next barrier was stigma. 5 out of the 6 participants reported that there was a stigma associated with receiving mental health services within their communities. And one reported that they were living in a mental health friendly area where stigma was less likely. The final barrier was access to services. All 6 reported that accessibility was an issue, including high cost of services, decreased availability, low prioritization of mental health services, and lack of time. The next theme was interpersonal collaboration. Participants attributed their knowledge level to collaborations with other professionals, including speech-language pathologists. Interpersonal collaborations led to more referrals to mental health services, and on-the-job training and co-treatment with speech-language pathologists improved their strategies and the tools that they use to communicate with those with aphasia. The third theme is that therapy looks different. Traditional talk-based therapy approaches would need to be altered for those with aphasia. Instead of traditional open-ended questions, mental health professionals may use yes-no questions, narrowing topics, and closed-ended questions. Participants expressed that there was a presence of frustration from both sides, both from the patient and the mental health professional. One participant reported feeling defeated after a session when she was not able to successfully communicate with her patient. In the discussion section, the authors reported their recommendations for strategies and training protocols, including the FRAME protocol. FRAME stands for F, familiarize yourself with how a patient communicates before starting the medical intervention. R, reduce the rate of speech. A, assist the patient with communication as needed. M, mix communication methods using methods beyond speaking and listening, including picture drawing and gestures. And E, engage the patient to respect their autonomy. The next strategy they recommended was supported conversation for adults with aphasia, or SCA. This is a training protocol provided by the Aphasia Institute focused on training communication partners in communication strategies. Their final recommendation was for stepped psychological care, which is a 4-stepped hierarchy of care to match the current psychological needs of a person with aphasia. An example of stepped psychological care in Level 1 is the Aphasia Action Success and Knowledge Program, or Aphasia Ask, and the SOPHIA trial. It should be noted that these techniques are described as emerging by the authors and currently being researched with promising results at the time this article was published. Next, I'd like to discuss my critiques of this article. The article began with a great explanation of what aphasia is, as well as other terms such as depression and anxiety. This would help someone who is not familiar with these concepts understand the article a bit better. The mental health providers were asked open-ended questions and asked to describe past experiences. However, because the authors were asked for personal recall that may have spanned over 5 years, accuracy of recall may be questionable. The authors admit that the interpretive analysis used in this study was meant to be exploratory in nature and not necessarily generalized to all mental health professionals. They used a snowball sampling. So they sent flyers to the email addresses and posted them on discussion boards that were frequented by speech-language pathologists and asked them to recruit mental health professionals. Therefore, we know that by this sampling method, the respondents would have some sort of working relationship with a speech-language pathologist. This would explain theme number 2. This article had a small sampling size, which is an issue. However, the respondents were from various geological locations, which is a plus. Different areas may have different cultural views regarding help seeking and mental health issues. In terms of the data analysis, the authors clearly stated the methods that they used to analyze data received from the common themes and patterns across the participants' responses. The authors make a point to reference prior research that a sampling size of 3 to 10 participants can provide meaningful information regarding participants' differences and commonalities. In their discussion, the authors highlighted the important points of their research and provided additional recommendations based on the information they provided for most of their themes. However, the subthemes of the stigmas surrounding mental health help seeking and challenges of dealing with clinician frustrations were not fully discussed in their discussion portion of the paper. This is an issue. The results and recommendations expressed can be particularly useful for clinicians and educators when introspectively evaluating their own trainings and training protocols regarding these themes expressed in the paper. It should be noted that a few of the recommendations listed by the authors were currently in the process of being researched themselves. For example, the Aphasia Ask and the SOPHIA trials. Finally, there did not seem to be a separate conclusion portion of this paper. Instead, it seems that the authors used the discussion section to express their conclusion, recommendations, limitations, and areas in need of further research. Next, I would like to provide you with a few discussion questions regarding this article. What are your thoughts regarding the themes and sub-themes developed from the experiences of these 6 mental health professionals? Did the results surprise you? Why or why not? What has been your experience with interacting with patients or clients with communication difficulties? Did your professional training include strategies to promote successful communication exchanges with these individuals? Does your organization provide training or educational opportunities related to communicating with those with communicative disabilities? If not, would such training be of value to the employees in your organization? Why or why not? To conclude, I have provided you with an overview of the article, How Do You Do Talk Therapy with Someone Who Can't Talk? This article sought to discuss the experiences of mental health professionals related to their treatment of those with aphasia. Although there were some limitations to this study, like small sample size, it does give insight into how mental health professionals may view and address talk therapy for their individuals with aphasia suffering from depression and anxiety. In this article, one can view the importance of emotional intelligence, cultural competence, compassion, and knowledge of models of behavior changes. Thank you for watching my video, and I hope you found this article helpful and insightful.